This is the Nurses Doing GAMSAT podcast, brought to you by Thankfully GAMSAT. We're here to teach you how to smash the GAMSAT, get into medicine, and become a flippin' great doctor.
Welcome, everyone. Welcome back to the Nurses Doing GAMSAT podcast. I'm Dr. Tom. We've got Marie here as well. And in a second, we'll introduce our special guest for today. But Marie, how are you going?
I am exhausted after a very eventful long weekend in which maybe, Tom, you can tell the story of what happened. But basically, my long weekend was not as exciting as I would have liked.
Yeah,
it was exciting, but not in the way.
Long weekend. Yeah, it was Australia Day long weekend. And then on Friday, I think it was Friday, I think our daughter has a UTI. So Marie's like, off to the ED. And then,
no, it wasn't the ED. It was the minor injuries clinic, Because
right. And it turned out it was a false alarm. She was fine. She was just dehydrated.
Yeah, okay. But do you really want to sit in the public toilets of the clinic trying to get a 7-year-old to pee in a cup? Like, how do you physically, oh my God.
Yeah, and we didn't want it to run through the weekend and not be able to see anyone.
Yeah, anyway.
So that turned out okay. And then on it was a Sunday night, I woke up at 4 a.m. with my heart just racing. And I was like, this isn't going away. This is weird. And I went to the ED before Marie woke up, and I just sent her a message saying, hey, I'm in the ED with, I think it was supraventricular tachycardia. I thought that's what it was, SVT. But they hooked me up to the ECG, and they're like, those are irregular heartbeats. I'm like, no, don't say that. And so essentially it's atrial fibrillations, AF. But I didn't have any symptoms. I was just sitting there fine, just reading my book, and my heart's racing at like 150, 160. And so I ended up, they didn't know why. They ended up in the hospital overnight just so they can kind of get it under control, which it spontaneously went back to normal. But it was a really eye-opening experience for a number of reasons. But anyway, I won't go into it because we have other things to talk about today, but it reverted. I'm fine. I'm back to normal, but it was an interesting experience and long weekend. Yay.
Yeah, particularly for me as a wife. I went to the ED because Tom leaves at 4 a.m. to go to the ED without telling me, sends me a text. I wake up at 6 and I'm like, WTF, when I get what has happened? I went to bed next to this man. And then so I turn up to the ED and the admin ladies there. I'm like, I'm here to see my husband. He brought himself to the ED without telling me and sent me a text. So I just want you guys to revive him so I can kill him with my bare hands. She's like,
did she say that to them?
Yes. She's like, got it. Yes. He's in bed number 24. She was like, I got you, girl.
Yeah.
Anyway,
the killing will happen later. But on that note, let's move on. So today we've got an incredible guest with us today. Her name is Gugu. She is now a second-year medical student at the University of Notre Dame in Fremantle. She used to be a physiotherapist. She might still be doing that. I'm not sure. We'll find out. And we're here to hear about her story because it had some ups and downs and all kinds of interesting things happened. And so welcome, Gugu.
Hey, hi, Tom Marie. Thank you so much for having me.
We're excited to have you, and we want to hear all about your story. So let's jump in. Let's go back to get a bit of background. So you're a physio and you wanted to become a doctor. Where did the desire to become a doctor come from?
It was actually the other way around. So I always wanted to be a doctor, and then I became a physio. So I was one of those kids who, from the beginning, said I wanted to be a doctor for as long as I can remember. I had little episodes where I think it was a stage of saying to my mom, I just want to be a mommy when I'm older. That's it. And my parents going, okay, that's great, but what? I'm trying to pull it out of me. And so, being a doctor has always been in the plan. And as I got older, I sort of realized that it wouldn't be easy for everyone, at least. And so I started to think about backup plans. And it's only in school where I then started thinking, all right, maybe I should actually look at what else I could do, in the meantime, or different pathways and the like. I don't know if you guys remember at school when you'd have things like set planning where you sort of discuss what careers you're looking into when you're older?
We
No.
didn't do that. No.
We used
I
to have
did
these
that.
sessions
It was
where
like uni,
like
and then you figure it out. Yeah.
oh no. We used to do these like quizzes, and the teachers would sort of try to figure out what you're good at and like career planning and the like. And I used to walk in there and be like, oh, you can skip me. I already know what I want to do. And I always just knew that that's what I wanted. And then eventually this, backup plan thing came along. And so going into physiotherapy was a very strategic thing of saying, all right, so it's still in healthcare. I'll have this exposure. And if anything happens, if I change my mind, I've got a hands-on career that I can still continue with. And it's a great career. And I didn't know much about it, but I launched into it thinking, all right, at some point, I will do medicine. So, yeah.
How
Okay,
long
cool.
was it between when you graduated and when you were working to when you started trying for the GAMSAT?
It was longer than it should have been. So I I got into physio and I thought, okay, so I'll just start working on GAMSAT in the meantime. And then my studies were just so full on and I was doing so much outside of uni as well. And so I thought, all right, maybe after I graduate, I'll do GAMSAT. And then I graduated, and that step up from being in your final year of a degree to your first year in the field is insane. So that you're adjusting to working full time, you're in this hospital environment, everything's so big and scary, and then imposter syndrome is already hitting. So I was sitting in there like, you know what? I can't think about GAMSAT. I just need to be good at what I'm doing right now. And so that was a year down. And then in that second year of practice, I started loving what I was doing. So I moved into a different job in physio and I just loved it so much. And so I was like, honestly, like, this is great. I could do this forever. So I think I'm going to forget about medicine. And then my parents sat with me at the end of that second year of practice. And we do this thing where we have New Year's resolutions together and we sort of discuss what we want as a family and then individually, and we sort of pray into that together.
Right.
And they said, will you be happy if you know that you never even tried? And I was like,
Oh, wow. That is a powerful question to ask.
exactly.
Wow.
Yeah. And so I ended up just thinking, you know what, okay, let me do it. And started, not knowing where I was going with it. So I was a bit all over the place with my start, but eventually got there.
It's so hard when you're working as well, and then you start earning a bit of money, and then you start having a bit of freedom, and like you can go on holidays and you can start doing stuff. I think then like it's really good that your parents like sat you down at that point and kind of got you thinking that way, because it's like I totally get when people are like, well, the time just gets away. Like honestly, it does.
Yeah, because it's not just the enjoying the job, it's also, oh, I'm getting money and my day ends at 4 and I can just go and do whatever I want and I don't have to think about anything. And then when you start thinking about medicine, like one thought I always had was, oh, but it's going to be years before you're even like knowing what you're doing in medicine. Like you have to study, and then if you want to specialize, it's more. So you know what? I don't think I'm going to do it, because if I do it, by the time I finish, I'll be in my 30s and I would have wasted my life and it's over. And that's exactly how you think as a freshly graduated.
Yeah.
Yeah.
And yeah, someone like said to me once, so I think I saw it maybe on Instagram or something, and it said, okay, well, if you don't do it, how old will you be? And I was like, okay, I guess time and age isn't really something that I should be using to stop me from doing what I've always said I wanted to do.
It's like you just summarized, like I just did a podcast on this. Anyone who's who's listening along, who's like, oh my God, I'm too old, please go to like the last episode, because legit I've been like 15 minutes talking about it.
Wow.
Because you're right, you're going to be how old if you don't go for it? You're the same bloody age. Like.
All right, and so then you added, you're working full time, you're living your life, and then you add GAMSAT study to that.
Yeah.
How did you manage your time and the kind of the workload?
Honestly, at the beginning, I barely did. I think I had so many power calls, just with needing to get that. It was almost more the motivation aspect. And then I later learned that motivation can't be what you're depending on. But it wasn't just the fact that I was working full time, because I think if that was the only thing I was focused on, I would be perfectly fine with finishing at 4, having a little break and then getting into it. But in my head, it was all the other things that I wanted to do that were seemingly more important at that time. So it was, oh, but my friend has this birthday party coming up, and oh, there's a sport party, and this is happening. Oh, my brother's doing that. And it felt like for so long in the start of my GAMSAT study, anything else was better than GAMSAT study. So, oh, do you want to walk my dog for me? Perfect. I'll get up right now.
Yeah, better than studying for poetry or
Exactly.
physics. Yeah.
Oh my God, Gugu, I have this funniest story about Tom. So when he was studying for the GAMSAT, he was studying at Gordon Library in Sydney. I don't know if anyone's in Sydney. It's like this old dusty library, and there's like
It's
there were like
tiny, yeah.
old books behind him. And he'd like call me in the evening and be like, studying, da da da. And he's like, there's the most interesting books that you've ever seen in this library. It's like no one's opened them for like a millennia, and like imagine the history and the this that's in there. And he was like talking about these books like they're the world's best thing, right? And he's like, I just every day have to fight the temptation from reading these books. And then legit, as soon as GAMSAT study was over, he never stepped foot into that library ever again.
Yeah, just the thought of those books was so boring. I was like, what? How could they ever be so interesting, eh? Because it's so much more interesting than studying for the GAMSAT.
Just like anything was more interesting at that point.
Yeah,
I kind of figured out a system because there are all these books and I legitimately wanted to read them. I could just reach over and grab them, and I thought, all right, I'm just going to write down the titles for later. Okay, I'm not going to do them now. I'm going to put them down, and I'll come back to them later because they're really, really good books. But I need to get back to studying. So I kind of figured out a way to get myself to study. And then later I was like, these sound so boring. I just threw out.
It's great how your brain does that. It wants to stay away from the hard things.
And that's what you were going through as well. Like,
because did you do the GAMSAT before you joined the boot camp?
I was preparing for it beforehand. So I hadn't done any preparation, and I was sort of like, you know what, I'm going to dip my toes into it and just see what it's like so that when I actually do it, I know what's coming up. And so I started just before that GAMSAT came up. Yeah.
Okay. And so then what about the kind of, what were some of the challenges that you faced with the actual sections of the GAMSAT? Was there anyone that was more challenging for you, or what was that like, the actual exam and studying for?
I think section 3 was definitely the most challenging. So I found section 1 really interesting because I'm, also love creativity. So I was really into poetry and stories and, that sort of thing, and language as well. I really love that kind of thing. Section 2 to me felt like a think piece. And so I loved it. I was like, yeah, I'll just write a think piece. But section 3 was the most challenging one because even when I was at school, physics and chemistry were not my favorites. I did them and I did okay in them, but I just didn't enjoy them. And so to see them come back up on the GAMSAT list, I was going, I was done with this. And as, a lot of people doing different health careers would know, you don't do chemistry and physics in the same way at uni. So biology is usually where you tend to go, especially with physio. It's anatomy and physiology. But seeing chemistry and physics come up in section 3, that was the most daunting one. And I think it took a bit for me to actually go, okay, I've got some strategies now and can approach it.
All right. And so you said something interesting, like you kind of mentioned on the self-doubt and kind of worrying if you could did you feel that you were wondering if you can do it, if you can get through the game, if this is something that you could overcome?
Yeah, absolutely. I feel like it's before I even started it, which is why my parents had to ask me that question. An element of me keeping away from it for so long was also me being like, oh, well, I probably won't be able to make it anyway, even if I try. And then even after starting, you'd sort of look at it and go, oh, this is so much. And even if I do well, I'm competing against so many other people. So that self-doubt definitely comes in. And I would say that it probably carried throughout the whole process. You still doubt yourself. You just have to get to a point where you're thinking, you know what, I just have to do the best I can, put it all out there, and then just there's nothing more I can do. But there's no point in me going, oh, well, I don't know if I'm going to do it, so I'm just not going to do it. But yeah.
And so when you had those moments where everything else seems more interesting and doable than GAMSAT, how did you overcome that? How did you turn that around? Or did you turn that around?
Yeah, for sure. I think one thing that I did that I wish I'd done so much earlier was really map out why I wanted to do it. Because when I especially if you've wanted to do medicine from a young age, it's just there. You almost lose sight a bit of why you want to do it. It's just, no, but I've always wanted to do it. It's just it. And so it's like evolved from being, I want to help people and I love biology, to being a lot deeper than that as I got older. And what I did, I think probably just after GAMSAT, because I was in that waiting period, I was starting to get a little bit stressed. And again, if it doesn't go well, am I going to do it again? And what's going to happen? And that sort of thing. So I literally sat down, went into Canva, because I like pretty things, and just wrote my entire reasoning why. And I think I still have it. I think it's like 3 paragraphs long or something like that, of, you know, the main reason that you sort of tell people when they ask you in passing, the reason that you would say in an interview, and then the deeper reason that's sort of like, okay, this is my own personal thing with it. And, you know, it might be super vulnerable, but I'm like, these are my reasons. And so as things got more difficult and you're seeing everyone else doing this and your family's doing that and you want to join them, I had to go back to that reason. I was so glad that I wrote it up eventually. Because I think it brings a different element, that emotional element, rather than just, oh, you know, block it off in your calendar, block the people who distract you. Like, I think that emotional element of it was really necessary for me.
Yeah, that's a really important thing that we talk about a lot to our books as well. It's like connecting with that reason why you're doing this, why you're putting yourself through this hell of that study.
Exactly.
And so, are there so without, you know, sharing anything that you're uncomfortable with, can you share any of those kind of reasons?
Yeah.
What's an example?
Yeah, so I think I sort of said before, the simplistic reason of I want to help people and I love biology, that obviously still stands. I think I'm someone who has always wanted to serve people, and it probably comes from my faith as well as a Christian, but I always wanted to serve people, but in a way that was tangible. So to say that this is what happened and you actually feel this difference, and this is, you know, I can account for what I actually did. So that's an element of it. And then obviously just being so fascinated by the human body is something that led me down that pursuit. But also I think seeing injustice was one of the biggest things. So especially around 2020, so that's the year before I graduated. The year of my graduation actually from Physio. And so seeing the injustice around the world and what that meant physically. So like at the moment, for example, we're seeing what's happening in the Middle East and around Africa. And we're seeing even now across the rest of the world, how a lot of these disasters that happen have a very biological and physical effect. And then you've got teams like Doctors Without Borders going into those places. And so for me, I was like, that's my key. That's my access. I can get in through that. That's what I need to do. And even as a physio, I'd looked into stuff like that and gone, okay, so worse like this, but that's not really the disaster situation that I can get into.
Yeah, we want more disaster.
Exactly, yeah. And so I think that's probably one of the bigger things for me. And then as I was getting older as well, I think another element of it was when I say to people, you can do anything you want to do, especially having 3 younger brothers, I'm like, just put your mind to it, you can do it. But I'm not going to do it. And so there's that element of of trying to be true to my word. And so that I could, to my brothers and to my kids in the future, say, see, if you want to do something, you can put your mind to it, you can actually do it. And this is the evidence that I've got that I actually tried to do it. Yeah.
Awesome. And so is that the path for you, Doctors Without Borders and traveling and being a doctor then?
It's still in there, yeah. I would love to do some outreach work still. So there's also Mercy Ships, which I think their office is on the sunny coast.
I don't know where it is. It's down the road.
It's down the road.
That's incredible.
And they're upstairs on top of the Century 21.
Wow, that's incredible. I haven't actually been there, but yeah, definitely that outreach stuff is something that still appeals to me. And being able to balance that with I want to say normal life. I don't know how to describe that, but with sort of that day-to-day sort of the classic work that you see with a doctor.
Yeah, we've spoken to a lot of doctors and surgeons particularly. They will do, for example, a couple of weeks in Papua New Guinea, or they'll go to different countries and they organize a trip of a bunch of surgeons go together and they go there for a couple of weeks.
That's
in between, you know, maybe every year or every couple of years. And that's a kind of a sustainable way that many have found to do that kind of thing.
I'm
Because I
meant
was
to.
thinking a lot of people can make it their full-time thing. They're always out there, but I don't know if my heart could take it. But yeah, I think that's a very sustainable way of doing it.
Mercy Ships does that kind of thing where you go on the ship for, so the way that it works, Tom, is they basically have this like a massive ship and they like go off the coast in international waters, from like a very undeveloped nation. So they'll go pick up a ton of, eye patients, for example, take them into international waters, and then all of the surgery and all of that kind of stuff is done, not like everything's on the ship, nothing is needed
Mm.
on land, and so they can recover and have a really safe space and then kind of taken back, kind of
Yeah.
recovered. But it means that short bursts, you don't have to be on the ship for like 3 years straight. They're kind of cycling through, I think maybe like 3 months or something like that. But there's
Yeah,
definitely like kind of batches. I think it's really cool.
for
Yeah, I
sure.
think Doctors Without Borders is a bit different, where you do commit to a certain amount of time, and it's a considerable amount.
Mhm.
So, I mean, if you've got a mortgage to pay and that kind of a thing, it might be a little untenable for some people. But
Exactly.
cool. So now, so tell us about life now as a med student. Are you still working as a physio? What's happening?
So I actually got my offer for medicine across the country from where I live. So I decided to just focus on just, experiencing moving out of home for the first time and being in this feels like a different world. I'll be completely honest. You think that being in the same country, it's just a smooth transition over, but it feels like I'm in a different country.
Yeah,
So yeah, I ended up not working, which I think is a benefit of having worked for 3 years, is that I could save up and actually be able to say, I'm just not going to work for a bit and focus on this new journey and this new place that I'm in. And then I've maintained my registration, so still doing everything that I need to do so that when I am ready and able to fit it into my studies, then I've got that as an option. And it is kind of scary thinking, oh, okay, well, what if I can't fit it in and then I lose that? Because it's obviously great being here, but a part of me is still like, oh, but I love being a physio. So I've definitely been still holding on to it.
I mean, it never goes. When you're a doctor, you're going to bring all those skills from when you're a physio into your practice of medicine anyway. So it's like you might not be registered anymore, and it's not like you're going to be seeing patients in that capacity, but all
Yeah.
of the experience counts. So don't just like step in as an intern on
Absolutely.
first day and just like remove from your brain, right? Like,
Exactly. And I think from my first week of medicine, I was already using that knowledge. It was so helpful. So, yeah.
all of my healthcare like practitioners, like physios, my nurses, my ambos, my pharmacists, when I say that, I'm like, you're going to like when you're in med school, you're kind of like a step ahead because you've got so much like patient interaction. And I remember, Tom, when you were an intern in surgery, you were, I won't say the doctor's name, but you were with another junior, like an intern when you started. And just the fact that you're a little bit older, when you went to see a patient that was a kid, I remember the story specifically. The other intern was like walked in stressed and just like the kid just like burst into tears because it was just terrified. And you, Tom, went to the other intern and was like, bro, you got to settle down. Like he had no skills in understanding patient care. He's like, you can't just like rush in and just scare the poor kid. Like you got to
yes,
maybe
yeah.
gently, gently. This is like a
But
stressful
even I
time.
wasn't that good. There were, because didn't have any healthcare experience beforehand, and there were. Remember, one of my best friends was a nurse, and he would be far better with the clinical side, the patient interactions, and I was just absorbing it all from him and learning it all. But
Yeah. Sure.
yeah, I mean, a lot of healthcare professionals, particularly nurses, they do work locum kind of shifts. Have you considered that as a physio?
Yeah, and I actually have physios in my cohort who do that as well. So they'll manage to do weekends or just fit it in around their schedule. So that's definitely an option. Um, and also the other option is trying to fit it into your holidays. So maybe, like you're saying with the locum work, if you've got the 4 weeks off over here, cram in that work, and then you can go back to studying later on. If you find a workplace that's really,
Yeah.
really understanding about that.
Yeah, cool. All right, well, let's circle back around to the GAMS and
Yeah.
talk a bit more about that. So you said that Section 3 was a challenge for you. Tell us a bit more about that. I know you didn't have much of a chemistry and physics background, but what were you struggling with? What was the difficulty? How did you overcome it with Section 3?
Yeah, for sure. So I think section 3 was just daunting. Even just looking at the questions and diagrams and
Yeah,
equations, it was just, oh my goodness, I don't even know if I want to confront it. So it was just, it felt unfamiliar, even though it was things that I'd done at school. I think I'd graduated 6 years prior to then seeing all this again. So it
yeah,
was really those basic skills for me that I needed to be able to recognize that, okay, this is the formula for this, and this is, that sort of thing. So a little bit of familiarity, not because it's, you need to know it back to front to actually do well in section 3, but I think it took away some of that scariness of seeing everything that's so unfamiliar. So I think my approach to it was really getting those basic skills down. So those E classes of, chemistry, and this is physics, and this is maths. Even I needed the maths too.
yeah,
You don't realize as a physio that the most maths that you do is calculating distances and reps and that sort of thing.
yeah,
But yeah, so getting those basic skills down pat was so important for me. But then I realized that more important than that was the reasoning, so that even when I did see something that was unfamiliar, I could still go through a reasoning process and get through it that way. Yeah.
yeah. That's a big part of Section 3. Is yes, you need to have that basics. The As we call it, it's kind of like a language. You need to know the definitions of all the different things, but you're not being tested on the definitions. You're being tested on how you speak that language
For
of
sure. Yeah.
science, and that's where the reasoning comes in, right? And so yeah, like you said, we have the E class with the basic science classes now, but it's the reasoning that really changes everything for a lot of people, and
Yes.
being able to face a question. Like recently, there was one about the anatomy of the gills of a fish. You're not covering that in your study.
Yeah.
And it's like at least 50% of Section 3 is going to be things you've never seen before.
For sure. And when you hear that word reasoning, I remember when I first heard it, I was going, but I don't understand. You know what I mean? It's so unfamiliar. And even as you start to learn, you're like, okay, but I don't get it though. And then when you do get it, you get it, and you say it to someone else and they have the same reaction.
Yeah, that's right. That's
Yeah.
right. That's kind of that's the process. They've kind of explained it really well. It's like that hero. It's like a hero's journey. Where like
Yeah.
they're faced with it and they have a dip and like, oh, I'm struggling with this thing, and then like reasoning skills, and they reject reasoning skills, and then they realize that it's there, and it's important, and then when that moment clicks, we call it that epiphany moment. They're like, oh wow, it
Yes.
is all reasoning skills,
Yeah.
and from then on, it really changes for people, and then you can go in there and, like you said, face these weird questions and be able to work through them.
Exactly.
Um,
Yeah.
cool. So, Marie, do you have any questions that you're kind of want to
I
follow
just
up
want to
on?
hear about med school a little bit. Like, what's exciting? What do you love? Like, tell me the goss. Like, I feel
Yeah.
like we haven't chatted for ages. I mean, do we have to do it on a podcast is the question, but whatever you
I
can share here.
Yeah, I really am loving it. I think it's crazy, walking, being like, this is what I like always dreamt of. Like, this is happening right now. And you have to pinch yourself so often. And I remember that first day, like that orientation where we all sat down and you just know you all feel the same. You all can't believe you're there. Most of us, I would say, felt like, we didn't deserve to be there. Like you felt like at any moment they'd go, oh, we made a mistake. Sorry.
Everyone but you. Everyone else
Yeah.
was just
Will
you.
will these three people please leave the
Yeah,
room?
exactly. So the imposter syndrome was real, but it was crazy, being with other people and knowing that you felt the same way as well. And people with all different backgrounds. So just getting to know, how people got to where they got to. So I had someone on my left who, you said that, oh, they, worked towards GAMSAT, they did this, and their undergrad, they just finished it, and then now they're here. And the other person on my right was, a husband and a father, and he'd done GAMSAT 8 times before he was in. So there's like just hearing those different stories and experiences was really cool. And then also getting into the learning. And like I briefly mentioned before, I think with the physio background, it was like seeing the other side of this thing, because I think health professionals know so much about, hospital system and even about medicine, but obviously there's so much more. And so you had this one door and now you're sort of seeing around the corner into everything else as well. And it's only just started. So we've only just started second year. So there's so much more coming, but already this year has been exhausting, but at the same time, super exciting.
Did you say 1 week in and it's exhausting? I forget.
Like I said, it's relentless, right? It's a huge amount and it's just relentless every week.
They made first year so exciting for us as well by scheduling all these activities and free food. And second year was just, all right, 8 hours.
Yeah, that's it. Yeah, that's all done now. Let's get to work.
Yeah. I was thinking, I think on that first day, I was like, wow, they're not even going to ease us into it. Not even going to, let us have a moment. But no, we're straight into it. But obviously for good reason. We've got a lot to do. We need to get through it. And I think being postgrad as well, it's like 4 years, we've packed it in. Let's get to it.
Yeah. And I feel like you had stuff all through med school. I mean, it was a while ago now, like no word of a lie. I'm like, pulling, like I've got to think about it. But when you were at med school, remember you had that camp? Tom was like, oh, we're going on like med camp for 2 weeks.
Yeah.
We got home and he said, I need a bottle of vodka and a cowboy hat. And I was like, what?
Med
camp. Yeah. See, those are things. Those are really exciting.
There's the dress up party. And I was like, okay.
Yeah. And the one bottle wasn't enough.
For sure. Yeah. They definitely packed in all the fun in first year, which was really good.
I'm sure second year will be fun. I'm sure there'll be stuff.
Yeah, absolutely. I think the fun now is obviously the things you schedule around your study, but I think the fun in study that I'm finding now is that we're getting into the pathology. So first year was, this is what normal is. Now it's like, this is how it can go wrong. And, even this week we've been learning about tuberculosis and I'm like, what? I didn't know that. What? I didn't know this. And I called my mom and I went, all right, so firstly, the bacteria is cold. We get into it.
Remember when you were in Bali, Tom, and you were in that hospital? So Tom did his med the 4 weeks at the end of fourth year.
An elective,
in Bali. And I was like, you're going to be in Bali for 4 weeks. I'm going to, because I work from home, so I could work anywhere. So he comes in, like, first day, he's, like, got the white little jacket on, because I had to wear a white coat. And it was a local hospital. It wasn't a private hospital. And I went to, like, take it and pick it up and just, like, chuck it into the wash or whatever. He's like, touch that. I've been in the tuberculosis ward all day. You probably don't want to touch any of my stuff. And I was like, have a shower. I don't know what to say to that.
You don't really see tuberculosis in Australia. But in Bali, they had the main hospital in Denpasar, and then off the little offshoot, smaller one where they had the tuberculosis patients, and they had all these negative pressure rooms, and you'd gown up with all these things and go in there, and it was really fascinating stuff. Similar kind of a deal. We had that in Vanuatu as well. In second year, I went over there, and similar deal with tuberculosis, separates, and in Australia, it's unheard of.
It'd be on the news.
It would be so interesting just getting to see what it's like around the world, because we're so privileged with our care here that when you see it places around the world, there's so much.
It is really, really cool to travel. And I mean, I had to organize that myself to go to Bali, but there were other people from other countries, the other medical students doing the same thing.
Yeah.
I'd highly recommend that. Sorry?
I said I've already started looking into it. I started, I think, end of first year. I was like, all right, where can I go with this?
Yeah, cool.
Yeah.
Where are you thinking?
Well, it's quite interesting because I think the UK I was leaning towards, and then I saw some smart traveler advice. I won't spoil it for anyone. And so now I'm thinking maybe Ireland would be a good idea. And then it's a good base to then travel through Europe. But there's so much to consider, I guess, with like an overseas elective. So outside of just cost, it's, would you rather maybe do a bit and then book a holiday afterwards? Or would you rather just, especially being away from home now and thinking, could I do my elective at home so that afterwards I've got, some familiarity with the system at home and, some connections back in Queensland and that sort of thing. So, so much to consider.
Yeah, there's a few different things. I mean, I love to travel. Both Marie and I, we love to travel and I think places like UK is lovely, but it's pretty much the same as Australia.
Yeah.
And so I was like, I want to see difference. I want to explore and get the adventure
Run
of
right into
different
it.
worlds. And so I was like, all right, where can I go that's going to be reasonable that I can get to? And so I was like, Bali, we've been there, we like it. We can have a holiday while we're there. And then Vanuatu was the same thing. I think I was there for maybe a week or 2 weeks doing the thing, and then afterwards we travelled around Vanuatu, which was really cool.
Some of your colleagues also went to Fiji, and that's because that was maybe first or second year. I don't know. I remember you saw your first birth. That's all I remember. You're
That was
like,
in Vanuatu, yeah.
not a baby person, not a baby person at all. And then literally calls me up and he's like, the magic of childbirth. Do you know what happens? I'm like, I know what happens.
Yeah, I didn't know what happened there.
I was too young. I was in my 20s then too. I had not had a baby at that point, but it was incredible.
Well, it's a different thing hearing about it to actually being there and helping out, and then being part of the whole thing. And in Vanuatu, it was very there was no pain relief for the mum or the medical students, right? So it was all just, and it was very clinical based. It was all, there was no magic to it. It was like, let's get this done. Let's make sure, look up the vital signs, the examinations, the kind of observations. And so it was very much based on clinical medicine and your knowledge of it and the process, which was really cool to see and experience. So yeah,
that's definitely something else that I've considered, thinking if I go somewhere so different to Australia, I'll have like a wealth of knowledge and experience from that. And then also you start thinking, okay, what about the language? What's the safety like? And what's this like? And so there's so much to consider. I only just opened the little
No, definitely. All right, so look, it sounds like you've come a long way from when you were first doing the GAMSAT and thinking about it. So if you were to give yourself a word of advice, knowing what you know now, to yourself back then when you were preparing for the GAMSAT in the early days, avoiding it, that kind of stuff, what would you say?
Can I say 3 things, maybe?
Yeah.
So I think I'd probably say the first thing is getting that plan up or that written, almost like a manifesto, I guess, of why do I actually want to do this? I think that's what I would have needed to keep looking back at and understand that sooner so I could get into it sooner. I'd probably also advise myself, or I guess remind myself that I would need those skills later on. And I used to hear that all the time, that like studying for GAMSAT isn't just about GAMSAT. It's about, getting the skills for when you actually do need to study. So when we wrap up here, I've got a study session. And that's something that if I thought about GAMSAT studying me having to do work on a Saturday, I would have been like, no, I could never. It's my one day. And so I think having those skills and sitting down, getting things done, just studying, just locking in, then that would make such a big difference. So I would tell myself that you're going to need this later. And then I think I would probably also just, I guess, tell myself to have fun with it too, because I think I always approached it as this really annoying thing that I have to do, an obstacle to me being a doctor. Whereas I think I probably could have approached it differently in terms of seeing it as part of the process, and I'm learning things from it, and how can I make Section 3 interesting, that sort of thing. So I think the attitude that you have towards it, just walking in being like, oh, this is such a drag and I have to do this and this is so annoying, can really make a difference.
Yeah. And so do you have a top tip for the science section for people who are struggling with that?
That's a good question. I think fall back on what you're good at in that section would be a big one, because I think I spent a lot of time, this is in the closer to the exam, that means, but I spent a lot of time really trying to do a little bit better on the parts that I really was horrible at. And I found when I got to the exam, I would skip those parts anyway and then go back and guess an answer and then go back and reason. And I was just sort of still avoiding it. So I think focus on the parts that you're doing well at, make sure you've got those down pat, and then work on the parts that you're not great at.
Excellent. And what about for healthcare professionals, nurses, physios who are listening to this and who are dreaming of becoming doctors, but they feel overwhelmed by the GAMSAT and the process, or unsure about it, whether they can do it or whether it's for them? Like, what's one piece of advice or more pieces of advice that you'd share with them?
For sure. I think I would probably say what my parents said to me. Would you be fine if you never even tried?
Oh,
Would you be happy with that?
Got goosebumps. I'm like, your parents are lit. We love them.
yeah. I was like, oh, can you
Um,
invite us to that New Year's Eve dinner?
Right. What do you
exactly.
mean?
Yeah.
Can they just adopt me already? Okay. Just
Yeah.
like-
I have something else that she said afterwards, and I might as well say it now because I think that's part of the advice that I would give myself. But my mom said to me, I think it was the middle break of my first year, and she said, if you knew that you could have achieved everything that you have achieved, do you think you would have been so slow with it or waited so long with it? And I was like, wow. I knew, and my parents just say these, they just throw this out and then go, anyway, so dinner.
Yes.
Yeah, I think so going back to the previous question, I think that would be a big thing, being like, if you knew you could do it, if you knew it was on the other side, how would you approach this study and how would you approach this preparation? But yeah, the other advice I'd have for a healthcare professional, I think, is that this is an extension of what you're doing, because I definitely felt that I was betraying my profession, even though I knew that I wanted to be a doctor. I think because I loved physio so much, I was also like, oh gosh, I'm a traitor. And, I'm, leaving this behind. And, yeah, just that struggle of being like, well, I should be happy here. Why can't I be happy here? And am I telling other people that this isn't a good place to be? And I think I struggled with that a lot. But I would say if this is an extension of everything that you want to do, so that idea of serving people and being in the medical industry and that sort of thing. So if you think of it as an extension, then you don't feel that betrayal. Because I'm sure I'm not the only person who feels like I'm betraying my profession when you're moving from one healthcare profession to another. Yeah.
No, I think from what you said, a lot of people are experiencing, they'll resonate with your message. A lot of people will find this really inspiring and reassuring. So thank you for that, Gugu. Thank you for kind of walking us through all that and explaining it, because that's really going to help a lot of people. So thanks.
And for being honest about it, because I think sometimes, like, it can feel like a competition sometimes, like you don't want to share it because is it giving too much away? And so just the fact that other people are going to say or feel, oh my God, I get that. Like, I feel like that. Like, first day at uni and you still felt like an imposter. Like, and it might never go away. You probably feel like that first day of intern as well. But it's the skill of working through it and doing it anyway. And I really
I agree. Because one of the things that frustrates me about the GAMSAT kind of area is that some people kind of come across as if they got it all sorted out. They got it all figured out. They're perfect. They're going to get it done in one. And if you don't, there's something wrong. But most people don't actually do that. They're having doubts and worries and unsure, and it's up and down. It's all over the place. So it's great to hear, someone here like yourself talking about that, and just not coming from just Marie and I, but someone who actually went through it.
Exactly.
And something else like
piece of advice I'd also give, which I really needed then and I still use till this day, is do it even when you don't want to. So often, I think right at the beginning of my GAMSAT journey, I'd go, well, I don't feel like, so I'm just going to do this for a bit. And, I might just open.
Is that something you heard from Marie? Did Marie give you a kick up the butt one time?
Yeah, I needed it. Yeah. But yeah, I think getting used to the idea that like sometimes you don't feel like it. Okay, sorry, but you have to do it anyway. And so I really, really needed that, especially, I think I was very fortunate in the job that I was working in. It was one where 4:00 struck and I could just leave it behind and I had a good day. It wasn't particularly stressful. But I think for people where that's a different experience at work, you really do need that extra sense of, all right, I'm exhausted. I don't really feel like doing this, but I have to do it. So I'm going to sit down and do it. And I wonder if that might be a change that someone else could do as well. Like if they're working in a job at the moment that's stressful and they come home and they're feeling burnt out and they can barely even think about studying GAMSAT, what transition can you make in terms of work to make GAMSAT possible if you know that that's what you want to do?
Yeah, that's a conversation that we have with many boots who are like, hey, I thought I could do this, but I'm burnt out, I'm tired, what do I do? And sometimes it's a matter of incorporating a few techniques and approaches and changes in mindset, like you're talking about. But then other times it's, hey, we might need to change the work that you're doing. Take less shifts. Don't say yes so many times, or changing roles. It just depends on the person and what they're going through.
Lots of people think time management's the issue, and sometimes it is. I'm not saying that it's not, but like more often than not, it's not time management, it's energy management. It's like you got time in the day, but you're just bloody exhausted when you get home. So we probably need to change things. But it's doing it when you don't feel like it. I just had a fight with my 7-year-old who didn't want to empty the dishwasher. And I'm like, I know I don't feel like emptying the dishwasher either, but you got to contribute to the family, right? Like, I know you don't feel like it. You got to do it anyway, doll. Like,
yeah. And I feel like some more, having moved on my own now and being in this new place, that like, if I don't do what I need to do, no one else is going to do it for me. No one's going to check on me. No one's going to, you know what I mean? Like I have to actually just do this. But yeah.
Speak to my 7-year-old after this because she's still not getting it.
I was going to ask your mum if she's got any words of wisdom for 7-year-olds and getting the dishes done.
Coming next week, it's Gugu's mum.
That's right.
One-liner and then she'll just dip. But
I wonder if they strategized the night before. She's going, honey, we're going to do this. I'm going to throw this one in.
If they, even changed the quote around and found some synonyms.
They're like a whole planning, like a storyboard of what they're going to do.
Yeah. And honestly, I think that would be another piece of advice. If you've got some good people around you, then let them in on what you're doing because they might be the motivation that you need to. And for me, I think I saw my parents as, nagging when they initially asked me that question. I was like, oh, why do you want me to do this? And, I think it was a bit of like protectiveness as well, being like, oh, I just don't want to say yes if I'm not going to do well at it. But I think having people around you who could motivate you, and during GAMSAT, it was if I've spent too much time on the couch, they go, oh, don't you have study to be doing? What's going on here? And then, and now I've got your uni group where it's, hey, are we meeting up and doing this? Oh, well, you said you couldn't make it last Saturday, so what's happening? But I think getting good people around you is definitely important.
I think the research that they've done is like you become the 5 people that you hang around the most in all facets. Like if you put like the net worth of your 5 people, you're going to be the average of it. Or if you're quite thin and then the people you hang around are not quite thin, then you slowly go to what the average of the group is. I was like, that's fascinating to me. But it does mean you got to find good people who are in the direction that you want to go. They don't need to be perfect. No one's perfect. Doesn't exist, but I agree. The environment and the people that you hang around, and it's going to get you doing more if you're in the right group.
Yeah, absolutely.
Excellent. All right. Well, thank you, Gugu. I think we can probably finish at this point.
Unless
there's more advice.
Oh gosh, I think it's one of those conversations, especially because it takes up so much of your life. Like if I think about from the start of my GAMSAT study to now, like the world of medicine is just a constant thing. It's just always there. So it's one of those things where I could talk for ages about it, but you're right. We should wrap it up.
I appreciate, I'm sure I'm speaking for Tom as well. We appreciate you sharing your story. I know it's going to help so many people. If in our Nurses Doing GAMSAT Facebook group, if you want to show Gugu some love and appreciation, we can tag her in the thank you post if they come. It would be lovely. And we just appreciate you being you. We want to keep in touch. Tell us all the gossip, 2nd year, 3rd year, 4th year, internship, residency.
Yeah, I'm excited for internship as well. That's going to be
absolutely. Thank you guys. It's actually, thank you for making the platform to share the story. And it's like a record, I guess, where you use it even outside of the world of medicine this is this one thing that happened through my 20s and I'm going to take this with me. So thanks for the podcast and thank you for speaking to me as well.
Wonderful. Thanks for coming along. Bye.
Hey, I have a cool gift for you just for listening to the Nurses Doing GAMSAT podcast. We do some of our best work in our Facebook group called, you guessed it, Nurses Doing GAMSAT. It's free to join, and every day we're sharing actionable guides, tips and tricks, and really just how to smash the exam and get into medicine. You can join today by searching Nurses Doing GAMSAT on Facebook. Thanks for listening to another episode, and I'll see you next time.